This video is all about blood pressure, what it is, why it's so important, and how to manage it. Did you know that nearly half of all adults in the US have high blood pressure? According to the American Heart Association, that's almost 1 in 2 adults with readings at or above 130 over 80 millimeters of mercury. High blood pressure, also known as hypertension, is often called the silent killer because it usually has no symptoms. Yet, it is perhaps the #1 preventable risk factor for serious conditions like heart attacks, strokes, heart failure, kidney disease, and even cognitive decline. In fact, worldwide and in the UK, hypertension is incredibly common. Over 1 in 4 adults in England have high blood pressure, and many people don't even realize their blood pressure is high until it causes complications. By the end of this video, you'll understand why blood pressure matters for everyone and how managing it can literally be life-saving. So let's dive in. Let's start with the basics. What is blood pressure? Blood pressure is essentially the force of your blood pushing against the walls of your arteries as the heart pumps. Think of your heart as a strong pump and your arteries as elastic pipes. Each time your heart beats or contracts, it pushes out blood. This creates a peak pressure in the arteries called the systolic pressure, so the top number of a blood pressure reading. Between beats, the heart relaxes and refills, and the pressure in the arteries falls to a lower level. That's the diastolic pressure, which is the bottom number of a blood pressure reading. So if your blood pressure is recorded as, say, 120 over 80 millimeters of mercury, it means the pressure was 120 millimeters of mercury during the heartbeat and 80 millimeters of mercury in between the heartbeat when the heart is relaxed. Why do we care about these numbers? Because they reflect how hard your heart is working and the stress on your artery walls. If blood pressure is too high, it means your heart, blood vessels, and organs are under constant strain. Over time, that strain can damage the vessels and vital organs. Please also be aware that if blood pressure is too low though, not enough blood reaches your organs, and this could eventually cause you to be dizzy and faint. Okay, we've spoken a lot about high blood pressure, but what is the general risk of having a heart attack or stroke, and how does a high blood pressure change this? Here are some numbers to give you a better idea of the general risk of an average person. A recent large German study showed that the absolute risk of having a heart attack or stroke for the first time within the next 10 years was about 0.5% for people aged 18 to 44 years. So that's around 1 in 200 people. This number increases as you age. Around 2.8% of people aged 45 to 64 had a heart attack or stroke. So that is around 1 in 35 people. This number was even higher for 65 to 79-year-old people, where 10.8% had these events. So that's around 1 in 10 people. So now, what are the consequences of uncontrolled hypertension? Large studies show that for every 20 millimeters of mercury increase in systolic blood pressure, or 10 millimeters mercury of increase in diastolic, above normal, the risk of dying from a heart attack or stroke doubles. High blood pressure doesn't only increase the risk of heart attacks and strokes though. Let's take a look at the kidneys, for example. Your kidneys filter your blood and they're packed with tiny blood vessels. Hypertension can damage these delicate filters, leading to chronic kidney disease or even kidney failure requiring dialysis. In fact, high blood pressure is a top cause of kidney failure. Hypertension also affects your eyes. High blood pressure can damage the small vessels in the retina of the eye. In severe cases, it can lead to bleeding in the eye or even blindness. Eye doctors can sometimes see signs of hypertension, like narrowed arteries or small bleeds, during a routine eye exam. Another example is that hypertension increases the risk of arterial disease in the legs and can cause wounds and pain in the leg. The high blood pressure can also weaken artery walls, potentially leading to dangerous bulges in blood vessels, which can eventually rupture. Given all these impacts, it's not surprising that hypertension shortens lives, if not addressed. But the tragedy is many people don't know they have it until damage is done. Remember we said it's a silent killer? Most people with high blood pressure feel absolutely fine without symptoms while the damage is slowly accumulating. That's why checking your blood pressure is so important, even if you feel healthy. Let's delve into how to interpret blood pressure. Blood pressure is measured using two numbers. Lower is generally better, and consistently high readings increase the risk of heart attacks, strokes, and more. As a simple guide, below 120 over 80 millimeters of mercury is generally considered ideal. Readings in the 120s or 130s systolic mean your blood pressure is starting to run high and is worth paying more attention to. Readings around 140 over 90 or higher are clearly high and should be discussed with a doctor. Very high readings, such as above 180 over 120 millimeters of mercury, need urgent medical advice, especially if you feel unwell. Different countries use slightly different cutoffs, but they all agree on one thing: the higher your blood pressure, the higher your risk. Blood pressure can also temporarily rise because of stress, caffeine, or nerves at the doctor's office. That's why doctors usually look at several readings over time, often including measurements taken at home before making important decisions. If you want to know more, please find some useful references down below in the links. By the way, a major problem is that many times blood pressure is measured wrong, and this could give false readings. In one of our next videos, we will demonstrate how to properly take your blood pressure. So consider following our channel if you find the information useful so far and want to know when that video comes out. The key takeaway is simple: know your numbers, don't panic over one reading, but don't ignore repeated high readings either. Knowing your numbers and tracking them over time is what really matters. So let's say you've measured your blood pressure. Now what's next? The answer depends on how high the numbers are and your overall risk for cardiovascular disease. Make sure to discuss your blood pressure with your doctor. All guidelines agree on a foundational step. If your blood pressure is above the optimal range, lifestyle changes are in order. Healthy habits can lower blood pressure and often prevent hypertension from developing or becoming worse. These include improving your diet, so the DASH diet is often recommended. Think of fruits, vegetables, whole grains, lean proteins, and low-fat dairy, while limiting sodium, saturated fats, sugar, and red meat. Regular exercise: aim for at least 30 minutes of moderate exercise like brisk walking most days of the week. Weight loss: if you're overweight, even a 5 to 10% reduction in weight can significantly lower blood pressure. Limit alcohol. Excess alcohol raises blood pressure, so the less, the better. Don't smoke. Smoking massively increases overall cardiovascular risk. Quitting is vital for heart health. All guidelines endorse lifestyle modifications for anyone with blood pressure above normal limits. In fact, the guidelines double down on prevention. It stresses a healthy lifestyle for all levels of high blood pressure and even for preventing hypertension in the first place. When blood pressure is mildly high, doctors don't always rush into medication. The first step is almost always lifestyle changes, like improving diet, being more active, reducing salt, and managing weight. Once blood pressure is clearly high, all guidelines agree. Medication plus lifestyle changes are generally needed because the benefits strongly outweigh the risks. If blood pressure is very high, such as over 180 systolic or 120 diastolic, especially with symptoms like chest pain, severe headache, or confusion, this needs urgent medical attention. One final point: in older or frail adults, doctors often accept slightly higher blood pressure to avoid side effects like dizziness and falls. Treatment decisions are always personalized, so please check with your doctor. We'll drop some links in the descriptions below so you have a better idea of when doctors call it hypertension across different countries. After all this talk of risk, here's the good news. Treating high blood pressure works. It substantially reduces the risk of bad outcomes we described. So how much difference does it make? A huge meta-analysis of clinical trials found that for every 10 millimeters of mercury reduction in systolic blood pressure achieved by treatment, the risk of major cardiovascular events drops by 20%. Specifically, that reduction of 10 millimeters of mercury was associated with 27% fewer strokes, 17% fewer heart attacks, a 28% reduction in heart failure, and even a 13% lower risk of death from all causes. Those are huge gains for a relatively modest drop in blood pressure. And greater drops yield even more risk reduction. This really shows that lowering blood pressure actively helps prevent disease. So the takeaway here is don't be discouraged if you're diagnosed with high blood pressure. We have the tools to manage it, and doing so significantly lowers your risk of the worst outcomes. In many cases, lifestyle changes can dramatically reduce your risk, and in some cases, antihypertensive medication need to be added. It's much better to control your blood pressure now than to suffer a preventable stroke or heart attack later. So that's it for now. If you enjoyed this video, consider giving us a like and follow. We'll be doing more videos about cardiovascular health, and we'll also be discussing some interesting technology that you can use at home to track your own health.